welcome to our monthly webinar on today's topic of engaging on a large scale. We're really pleased to have you with us all today. My name's Derek Blues and I'm an Engagement Programmes Manager in the Community Engagement Directorate of Healthcare Improvement Scotland. I hope you're all keeping warm on this cold but hopefully bright day wherever you are in the world. And just a word of thanks to Richard and Linda and their team for coordinating all the hard work to bring us here today. We'll be switching off the sound and picture, the camera and your mic during the session to help with sound and picture quality, but you can use the chat box throughout the webinar, and if anything's not covered by the presenters, we're going to pick these up by a Q&A session at the end and we'll switch the camera and mic functions back on. We'll also be sharing the slides and the recording of the webinar on our website, and at the beginning of the session we're going to use a word cloud to gauge your thoughts on large-scale engagement, and we'll revisit that at the end of the session and bring up another one just to see where that shifts to after the session. You can find out more about our sessions and events that are coming up, and we'll refresh our web page to show that, and we'll stick a link in the box for you. On there you'll be able to see our previous webinar sessions, and we'll be populating that with our forthcoming ones. If you do have any technical difficulties during the webinar, please could you contact Linda Young on her email address of linda.young14@nhs.scot. So with that, and I can see the attendees are nearing 100 now, which is fantastic, I'd like to pass to Karina, who's going to be our first of 4 speakers today. So Karina, over to you.
Good afternoon. I'll just share my presentation. Hopefully you'll see this just shortly. Okay, can you see my presentation?
Karina, I think the word cloud's just finishing off, so we'll just give that a moment and then your presentation should appear. Just give us a second. Okay, thanks for the responses to the word cloud. They're still coming in, and we can see that there's some interesting words there around what people are feeling around large-scale engagement, and we'll come back to that at the end. But Karina, we'll share your presentation and please go ahead.
Okay, can you see that now?
Yep, on screen.
Okay, thank you. Thank you for inviting me along this afternoon. My name is Karina Ebdi. I'm a location manager with Aberdeenshire Health and Social Care Partnership, and I'm here today just to tell you about a project that I am the project lead for. We undertook a strategic needs assessment of all health and social care services in Deeside and Upper Donside. So I'm just going to talk you through kind of what we did. So the strategic needs assessment was decided to take place in May of 2021, and it was to look at all services in the area and look at whether or not they're fit for purpose now, but also in 10 years' time. And this is in response to changes in the community, so the age of the population, the health conditions that people are presenting with, and also looking at how people access services and with the kind of advancements in digital technology. So what we did, so initially we did start with staff engagement before we moved to public engagement, but what I'm going to focus on today is what we did during the public engagement. So for that, first of all, we carried out a survey and alongside the survey, we had a series of drop-ins to kind of give people a bit more information if they were unsure about the survey, and then we followed that up with some focus groups. So just to give you a bit an idea of the kind of area that we were covering. So this is a very zoomed in map of Aberdeenshire. So we're looking at Banchory here on the east and covering the area right across to Braemar, but also branches into the Cairngorms. And then we go right up kind of northwards up to an area called Strathdon, which is up here, which is quite a remote kind of community. This whole area is about 774 square miles. If you were to take a bus from Banchory to Braemar, this would kind of take you about an hour and a half. If you were to drive, it's maybe about an hour. And then to travel from either Braemar or Banchory up to Strathdon, there is no public transport that cover those routes. So you'll be talking about 45 to 60 minutes by car. And to give a picture of the services that we cover in this area, there's 2 community hospitals. 2 of them have general admission wards, and one also has a dementia unit. There's 1 internal care home, as well as 4 privately provided care homes and a very sheltered housing complex. And then there's also various leisure centres, 7 GP practices, community campuses, and other services. And there's also care at home, which is both delivered by the Health and Social Care Partnership and also private providers. So what we did, we had a community survey, which we conducted primarily online. We use a platform called Engagement HQ. There will be a link to the page will be dropped into the chat, so you can have a look at it if you wish to do so. And from the survey, we had 992 completed. Of those, 874 were online, and there was 118 paper copies. And in order to get the paper copies, we had 15 venues across the whole region agreed to take paper copies, and also had returns boxes so that people could return them. There was also the facility online for people to print the survey if they chose to do it that way. Like I said at the start, we had a series of drop-in sessions, and these were so that if anyone were having any difficulty accessing the online, if they had any questions or needed any support to complete the surveys, they could come along and speak with, it was myself from the project team that attended those sessions. We had 15 people that attended, and of those 15 people, 9 of them took a paper survey away with them, and the remainder said they were going to complete it online, because we also had QR codes that they could follow. From the survey, we also wanted to know whether or not anyone would be wanting to attend a focus group or receive any follow-up information. So we had 231 people provided contact details to be added to a mailing list for future developments. The survey was open for 6 weeks, and then we moved on to focus groups. So we'd initially planned 24 sessions, and this was on a variety of dates, days and times, and also looking at different locations across the area. And this was in response to what people had noted their preferences would be in the survey. Very early on, there were some of the sessions that had like either 0 or 1 or 2 sign-ups. So we made decisions quite early to cancel 4 of them so that the people who'd booked on there could reschedule. There were 16 in-person and 4 online sessions across 7 different venues. We had 111 people attended. And after we'd completed the focus groups, we'd noted from the survey and the focus groups that there was no responses from people under 18 or from who'd kind of noted about having a disability. There was very low, people had filled that in on the demographic information. So we added in a session at one of the secondary schools and also a learning disability day service. So looking at some of the highs and lows of what we did, so in relation to the survey, it was definitely a very good idea to have the paper copies, and because we definitely feel that that boosted participation, and also we went out and delivered them by hand to all the venues, so that immediately kind of raised visibility of what we were doing, and had people putting a face to a name. The drop-ins that we did whilst the survey was live also started kind of conversations with people and got people to start speaking about what we were doing. And the online engagement HQ platform, again, that was an easy access for people, but it was also easy for us to keep people updated because we could put updates within the narrative on that page. Some of the things that didn't work so well, we really struggled to get an easy read version of the survey. So we were aware that that potentially excluded some groups. And also when I talk about geographic split there, we did a pre-publication consultation of the survey just to make sure that the survey was understandable and would generate the information that we were looking for. When this project first started, it was always referred to as the D-side Strategic Needs Assessment. And a week after the survey went live, we received feedback from numerous sources that the survey was excluding the people of that area that I pointed out in the North Stratton because they identify as being residents of Upper Donside rather than D-side. So we were unable to change any references in the survey because we'd already started to receive responses, but wherever we could, we then changed any references to be D-side and Upper Donside and did that for the remainder of the project. And in terms of the focus groups, a definite high was the amount of staff support that we received. So over those 20 focus groups, we had probably just as many staff supporting the project. And this was kind of crucial to making sure that all the sessions could go ahead. During the focus groups, there was a lot of discussion. There was a lot of notes gathered. We had a note taker at every session, and the discussion highlighted that there was a lot of common themes, but there was also variety depending on the groups of people and where we were. And then again, those additional groups that I mentioned, they were kind of very useful because it meant that we were able to then capture some of the people that we felt that we'd missed in terms of the demographic representation. One of the lows was the registration numbers. So as you'll see at the start, I'd kind of mentioned that we had 231 people had left details, but we only had 111 that actually attended. That was 143 people had signed up, but some people didn't make it. And this was despite sending out several emails to all of those people that had provided email addresses. So it was a lot lower than we were expecting. We also did a post-it note exercise during the focus groups where we were wanting to get a bit more information in terms of what services people felt were most important, and it didn't quite work the way we wanted it to, and it was also really difficult to kind of capture the information because post-it notes sometimes come unstuck, so it was difficult to see which question they'd related to. So that was definitely something that was a challenge, and we'd kind of think of a way to do it better in future. And in terms of what we learned, so the awareness of community identity, so that bit about having people identifying as being resident of D-side or Upper Donside, that was definitely something that we needed to have a bit more aware of at the start because we were potentially going to exclude some people from that point. We also found that understanding how the information is broken down by whatever platform you use. So for us, it was Engagement HQ to analyse the survey. There were some questions we would have maybe put them in a different format or asked in a different way to be able to have information to be broken down in a slightly different way to give us better quality information. Ensuring that you have neutral facilitators. This might seem like an obvious point. We felt that our facilitators were neutral because it was people that weren't associated with the project, but it was people that possibly lived in the area, and sometimes I think there was one situation where we had people within the group knew the facilitator, and it almost made them a bit bolder to ask questions rather than kind of just listen and respond to what was being asked. So just being aware of that because it could put the facilitator in a bit of a difficult position. It's good to be very clear on what you're asking and why. So for us, as I said, we covered quite a large geographical area and a lot of services. So it was a really broad scope, which then means that answers could be diluted. So if there's a question that you want an answer to, make sure you ask that question. We also found that having open and clear communication was vital. So for example, we had to change our process after we did the engagement, but we were able to clearly communicate this because we already had the Engagement HQ page where people knew that they could go for information. Plus we were able to email information out to the mailing list to let people know. And then finally, we had an easy read difficulty with the survey, but we also found when it came to doing our final report, it was quite challenging in terms of how to get that into an easy read version as well. We had a full report that was over 60 pages, plus a summary that was 14, but to then get that into an easy read version was really challenging, and we ended up having to outsource it. But it takes a lot of time, cost, and it's quite a complex process. So it's really good to have an awareness of what might be needed for that from the start of the process. And that's the end for me.
Karina, thank you. There are 2 or 3 questions specifically about your slot within the chat box. There's one around, was there different types of feedback between the surveys and the focus groups?
So we took questions from the survey that we wanted to expand on a bit more, and that was the questions that we then asked in the focus groups. So there was some themes that came out looking at transport, around kind of people were aware about recruitment challenges within services. So we asked for expansion on those just to get a bit more information, to kind of just hone it down a bit more.
Okay, there's a question about how people whose first language isn't English were able to participate to have their views heard.
So again, we offered on the Engagement HQ website, there was a section that had how people in different languages, how people could request a different version, and we'd identified a company that could translate if we needed to. We didn't get any requests in for that though, but we did offer it.
Okay, thank you. And another question about how were service users involved in the design, development and delivery of your process?
So it was at that stage of prior to publishing the survey, we contacted some community groups and community councils and asked them to feed back on any difficulties that they had with the questionnaire, and also how they would kind of maybe answer some of the questions just to make sure that we were asking them the correct way. And then also with the focus groups, once we'd worked out the questions going by the kind of themes identified, again, I had conversations with 2 or 3 different individuals just to make sure that the questions, again, were going to generate the information we were looking for and that they were understandable.
Great. There's a general question in there, Richard, that I think we might want to come back to at the end of all 4 of the speaker slots about what people feel are proportionate numbers of large scale, what would constitute large scale. So maybe we could come back to that when we've heard from all 4. A couple of other questions. One about how did you evaluate the engagement? Was it as you went along, or was it at the end of the project? And did you have staff reflections as well as participant reflections in there?
Yeah, so we did feedback questionnaires from the focus groups. So we'd asked people, you know, how they'd felt about the session, whether they knew what a strategic needs assessment was, whether they'd felt they'd been able to contribute, and that was on the whole very well received. And sorry, what was the last part of that question?
About whether you involved staff reflections as well?
Yeah, so we had a staff debrief after every focus group session, so staff were able to kind of share their experiences there.
Great. There's a bit of intrigue about the being bolder and asking questions, about that being a downside.
It wasn't necessarily a downside. It was that and again, this came from having the debrief afterwards. It was one of the facilitators had felt that they were kind of put on the spot, and they'd felt that they hadn't necessarily responded appropriately. But I was at every session, so I was able to kind of feed back to that facilitator that, you know, from my perspective, they were asked a direct question and they were able to deflect it and bring it round to the conversation. So it was someone, I can't remember exactly what the question was, but someone had asked something direct about their opinion on whether or not a service should close. So that was the kind of context that it was in.
I guess a lot of us have been there with those types of things. And the final question was about what made the easy read particularly challenging. Was there a budget around easy read or sign language?
So we have in the past, when we need any easy read documents, we've had someone kind of within a team that we go to, but that team is just massively overwhelmed, so they didn't have the capacity to do it. So we just weren't able to get the survey turned around in time. And it's taken us about 2 months to get an easy read version of the report, and that has involved going external to do that.
Rena, thanks very much. Really comprehensive answers to the questions. Thank you for your presentation, and I'll pass to Lois in Lothian now. Thank you.
Hello. Okay, so I'm just going to share my presentation. Okay.
Thanks, Lois. We do have some background noise, so not sure if somebody's got a.
Oh, I'm afraid it's the meeting room next door.
Oh, is it? Yeah,
Yeah.
no worries.
Is it really
Crack on.
bad?
It's not too bad. Crack on. We'll keep an eye.
I'll try and move to the other end of the room. So my name is Lois Marshall, and I was involved in helping Midlothian Health and Social Care Partnership develop their new 3-year strategic plan, and also the consultation that was undertaken to support the development of the plan. And this was from December 2020 to April 2022. So before I begin, I've got a question for everyone, and I think that's going to be posted into the chat box, and I'd like you to either give a thumbs up for yes and a thumbs down for no as to have you read the current 3-year strategic plan for your local health and social care partnership. So we can all be honest, but I want you to give a thumbs up if you've read your local health and social care partnership 3-year strategic plan, and a thumbs down if you've not. So I think that should be okay just to go in the group. And for those that have read the strategy, I would like you to say whether or not you did that in your free time or whether that was in your work time. So if you did read the strategy and you have read the strategy, did you do that in your free time or did you do it in work time? Just have a think, tell us your answers. There's no judgment here. We can be completely honest. And then it's not a question that you need to respond to, but I want you to have a think about, for us, we're a group of people who work in health and social care. I want you to have a think about your mates, your pals, your family, acquaintances. Is there any people that you know that have read their local health and social care partnership strategic plan who are not working currently in health and social care? So just some things just to start us off and help our thinking before we move on. So I'm hoping this will. What we thought about was how many local people are going to read the full draft of our strategic plan and give us their feedback. So the population of Midlothian in total is 43,000, and this picks up on one of the questions that's come up already. How many people do you think is appropriate for us to have aimed to get feedback from on the full draft of the strategic plan? 43,000 people in Midlothian. How many people do you think that we should expect to have read that full draft and given us feedback? So I'm not sure if it's going to come up in the group, but just again, another question just to get you thinking, maybe write it down or have a think about that. So what we did in Midlothian, just to give you a bit of context, this is the full content that was in the draft plan. So these are all the different areas that people were able to be consulted on for the full draft. So as well as what we're trying to do, we had areas around older people, frailty, learning disability, long-term conditions. So as you can see, the plan was very wide-ranging. So in terms of the consultation, we had very clear legal requirements about what we had to do. It's in the Public Bodies Act. It's also in government guidance around the engagement and consultation which we had to do. However, what we wanted to be really honest with ourselves and with our population was about the level of power and engagement. We wanted to have a think about how likely it was that we were going to change the whole plan once it had been written, drafted, and change it all drastically and within a tight time scale. And thinking about that, and again, thinking about people's motivations, what we wanted to think about was what's the best way that we can engage with people in the plan while still meeting our duties. So what we decided was we had a wee thing and we thought, are we going to be able to use the feedback that we get at the end, or is there a better way to do things? So what we wanted to say to people was it was their responsibility, but we would support them. So this is the response. that we got when we explained that consultation was going to be everyone's responsibility. If you want to have a quick look, and you can maybe have a think about which cat you are right now. How do you feel about if someone was to tell you that the consultation was your responsibility? But we felt this was more realistic rather than one person being seen as being responsible for the consultation of the plan. And we didn't leave people just to do it themselves. We had a really clear setup for the consultation. We identified the leads for each different area of the plan. We discussed our proposals. We had support from our board. We had clear timescales and deadlines. We had key responsibilities and asked for people, and we were able to offer support. So that was in one-to-one phone calls, in group meetings. We were sharing good practice. And we also provided a template and support for people with writing up the consultation report. So people knew what they were going to be asked to give us information on. And then we were also able to kind of really support them in terms of the write-up of it. So that was how we set it all up. And we didn't have anyone whose sole responsibility full-time was around the consultation on engagement of the plan. There was myself, but I had a range of other work priorities to work on, along with our public engagement coordinator, our integration manager, and the planning officer for older people. So we had different people who were able to give support in different areas, but everyone was balancing this alongside other areas of work. So again, this meant it was really important that we had a range of leads working on each area. So in terms of the consultation that was undertaken by the planning leads, they worked with partners, they worked with different frontline staff, they worked with all the people from their area, they worked with their third sector organisations to consult with them around what they thought should be in the plan. And we left it up to the leads to decide the most appropriate method of consultation or methods, whether that was surveys, whether that was focus groups. For some areas, they'd maybe already just undertaken a large consultation for something else, in which case they were keen to avoid duplicating and avoid asking people the same questions. We also had the Midlothian Citizens panel, and we were able to share the information that came back from that. So combined across all the different areas and all the work that the different leads undertook, 3,000 people in total were consulted in the development of the draft plan. And we created consultation reports for each area so we could see what information had been consulted on and what people had told us. The feedback that was given at this stage had a really big impact on the development of the plan. It was used by the leads to help make the decisions, to help prioritise, and in some areas, people were co-designing the plan and helping to write it. So for example, for the Older People's Plan, Older People's representatives were really well involved in co-designing the plan. So in terms of the consultation that we then undertook on the full draft, we had to think about how we could make sure the survey was designed in a way that we could use what people told us. And we were really aiming with this final consultation just to check if we got the strategy right, if there were any gaps, and to raise awareness of the strategy. We were impacted by COVID, so our planning was in October to December and the survey was in January to March. And the draft plan, we made it available online, but we also made available our joint needs assessment and all the findings from the consultations, all the different consultation reports. So what we did was we were able to tell people, this is what we know in terms of our data on all our different populations in Midlothian. This is what people have told us. This is what we've heard from people so far. And this is what our plan is. This is what we're planning to do. So together they made a coherent whole for anyone who was looking to really understand about where the plan had come from and why we developed the plan in the way we had. In terms of the consultation on the full draft, people could feedback on any part of the plan. So they could feedback just around older people or just around learning disability, or they could feedback on the plan as a whole. And then we made sure there was time and a process so that any comments were fed back to the different service areas or the different leads so they could take them into account before they finalised the plan. So how many people did we have? Well, in terms of what the timings, we consulted between the 19th of January and the 14th of March. We did a public awareness campaign and we posted out a postcard to every household in Midlothian, and we also had paper copies of the survey which were available in libraries, and there was support for people if they wanted help to fill those in. So just to kind of recap, we had the postcards were delivered, 43 different thousand households, and we had 80 responses. But we were pretty pleased with that because we knew that we had done such a range of engagement and consultation in the development of the plan. In terms of the responses, what they let us know was the majority of people felt that the plan was right, that the things that we had included in the plan were relevant and proportionate, and there was fairly positive feedback. And we were also able to add any of the final feedback or any of the gaps that came up to the final report before we then finished that and published it. So I am just gonna stop sharing. I've kind of whizzed through that.
Lois, thank you very much for that. There was a lot of warmth in the chat box and a lot of engagement around the proportions and the approaches. So there's a couple of questions. We are going to come back to those at the end, just conscious of time. So we're going to move on to our next speaker, who is Ellie Harrison. But Richard is kindly keeping an eye on the box and we'll revisit some of the questions towards the end. Please come in, Ellie.
Hello, I'm actually going to pass over to Lorraine first of all, and I will share my screen while she is introducing herself.
Thank you, Derek, and for inviting us today. I'm Lorraine Cowie. I'm Head of Strategy and Transformation in NHS Highland, and I am ably assisted by Ellie, who's not Ellie Harrison, but Ellie Skinner anymore because she just got married. So in terms of what we did, this was about developing our NHS Highland board strategy. And you may be aware that we've had some challenges with the Sturrock review and just about how communities felt involved in our future. So when I was brought on 18 months ago to NHS Highland, one of our key things was to develop that strategy. And I was really keen not to take it from like what some of the other speakers have said too, but we really got our communities and our workforce right behind us and what that future would look like going towards 2027. And a lot of our initial early engagement to develop how we were going to take this forward was from our workforce and how they wanted it designed and what they felt, and also with our communities and our partners and what they felt were the issues. And we come up with kind of a list of 12 things that they could comment on that came from them that started to help develop our strategy. We've got it there in Gaelic too, because that's a key language for us in Highland. And that was something that came through in our initial engagement, that they wanted to see that really brought forward. So that's Curum Cova, which is Together We Care. Next slide, please, Ellie. So one of our main things was to get all our localities involved. We've got 9 areas within NHS Highland. At the same time, Argyll and Bute were doing a fantastic job developing their strategic plan. So they were doing some similar engagement. So we did have that whole system. We wanted all age groups included, especially for children and young people. They're our future. And we wanted to see what they were saying. So we made sure that we had all the age groups involved. And all protected characteristics. Ellie and we were a very small team. There was me and Ellie and one and a bit others, but we did make a huge effort to get all our protected characteristics involved in that engagements piece. So for Highland, we're 42% of the landmass of Scotland. We've got 4 RGHs, 2.5 hours from Raigmore in terms of getting to Caithness. We've got 20 community hospitals spread over, and you'll see the geographical spread that we've got across that. We're quite a small population, but difficult to engage with, and we've got approximately 10,700 members of workforce. So we made sure that we had a good range across all our population and our partners across all of that stages of life cycles to really sure we heard the voices of that harder to reach groups. And I'll pass to Ellie, who's going to take you through how we did it.
Hello. So what we actually did is that we wanted to make sure that people could engage with us in a way that suited them, rather than us. And I think especially because of our remote and rural geography, we needed to make sure that those who lived in our most remote areas also had a chance to be heard. So what we did was we created this, which is a menu for engagement. So people could pick a method of engagement that suited them. This meant a few things. One, it was quite difficult to keep track of what we were doing because there were lots of streams and it was like running 8 projects at once. But it also meant that we could see which methods of engagement worked best for people living in different areas, which was really interesting. So we did face to face across our geography where we could because of Omicron, and people were really grateful if we were willing to travel. We did post, so free post. We even got some Christmas cards, and our partners got involved in that and also delivered free post envelopes to their service users to sort of widen the spread. We did email, generic email account, long, short, rude, passionate, happy emails appeared in the inbox. This was used mostly by workforce and our partners rather than the population. We did DIY sessions, so mostly NHS service managers or our own partners could run their own sessions. Um, we hope that people might be more open with us not in the room, and then that would get fed back to us. As others have said, the only issue with that is that we needed to ensure that the person running that session had the right vision of what we were trying to do. We did virtual sessions. These were really well attended at times and much fewer people at other times, but they were great for a really in-depth and quality discussion and information. We did press and media, which was more of an output method. We used radio, newspapers, etc., to communicate what we were doing, why we were doing it, and letting people know how they could engage. Social media, a bit the same as press, but we also put up quite a few photos of us out and about doing things just to try and show that personal side behind it. And that actually really worked in terms of engagement. Also asking partners to share their um, social media pages and posts with us. We also did a survey and we did paper, electronic, and an easy read version. Initially, it was too long and we had to shorten it, and that was a good learning point for us. Not as high quality in depth information from that, but a much wider spread. All the information gathered was qualitative, and we then put it through thematic analysis. And there's a huge amount of information now to support almost every area of health and care across Highland. It can be used in business cases, SBARs, and general direction for the organisation. Um, so this slide shows the actual number of sessions held and surveys that were responded to. Each of these engagement sessions, some only had a couple dial into them, some had well over 20, 30, 40. So there was a real spread. The key thing to think about from our point of view is the time and place. We needed to set these up when people were free and in places that they could get to, things that suited them rather than us. I think one of the key learnings for us was not to put more work on our shoulders and expect people to jump into our meetings. A lot of it was making sure that we could attend pre-established meetings. So whether those were community council meetings in the evenings, community partnership meetings or third sector events, we would go along to those, which was really useful. The same applies for online events. We made it as easy for people as possible. As few clicks as possible to get into an event with no pre-register is what worked best for us. Zoom was the preferred platform, but we aren't allowed to use that, and actually Teams worked just as well. I will do the lows first so that we can then do the highs. The lack of a CRM tool was really difficult. It meant that there was a lot of time spent on admin, there was duplication of effort, and it was really confusing trying to keep track of who you'd spoken to and about what. Belief, this kind of ties into the one below vision, but they are different. We needed our organization and especially those at exec level to believe in what we were doing and why, and at times this was tough. And vision, I think that links to the concept of how engagement led to strategy and how strategy has led to change through planning. And people didn't always understand the vision and where we were trying to get to with it. Engagement was really slow to start. We had repetitive conversations, which could be pretty draining, but it did snowball and grow and grow and grow. The data was all qualitative. This plus the various methods of engagement made the collation really time consuming and difficult, and the same applies for data analysis. We did end up creating a glossary for data analysis, and that meant we could pull in some extra help for a month to get it done. We've also got on here speaking directly to those who use our services as a low. I think that at times, and I'm sure Lorraine will agree, could be exhausting and taxing and draining if those people had had negative experiences. There was a need to apply empathy and also personally for me to lose my NHS hat and my need to defend our services, because that's not what we were there to do. We were there to sit and listen and feedback, and that was good. The highs, again, conversely, speaking to those who use our services, was one of the biggest highs. It reminded us and connected us to the people who need our services, and it was incredibly humbling to do. Passion, those who attended the sessions were really passionate, and that buoyed our own sense of passion in our organisation and why we do what we do. Being able to connect the experiences of the past and the here and now to the future was pretty incredible. And that relationship of time is evidenced in our learning and how we're now working as an organisation moving forwards. Connections were made and these have lasted, and we're keeping those connections with our partners going through our programme boards now. The changes that followed the engagement have been huge. It's resulted in a redesign of our programme boards, more and continued engagement, structured annual delivery plans, and all of this is being informed through engagement. There's also a whole new energy and drive that's come in, a focus and direction that is delivered purely because of that engagement that happened. And I think that the final one on here is that this wasn't created in a dark room. We were really transparent and unified. We listened to the engagement and now we're acting on it. One of Lorraine's great phrases is the "you said we did." And that really is how this was created, sort of by our people and population and partners. And it's now owned by them as well moving forwards. And I will hand back to Lorraine.
Thanks, Ellie. In terms of our lessons learned for it, I've seen some of the comments. Yeah, it did take time, but what we've ended up with is a strategy that's owned by our communities and our workforce. If you've seen the strategy itself, you'll see it's populated with hundreds of quotes from people in all the sections. Whatever they said is reflected within there and the actions we will take. So it's really owned by people now, which is lovely to see. People talk about Together We Care. People know that it's our future and what will take us to 2027. So yeah, it did take time and resource and energy, but as Ellie said, what a drive it's given us. We didn't know about that management system that Karina spoke about, so perhaps that would have been really good for others to learn from, but it did give us that kind of drive and give a context for people. I mean, Ellie's in my team now for it, and I'm really grateful for that. Just that clarity of roles, that team, there was a bit of kind of argy-bargy, comms wanted to do stuff, we were doing stuff, there was other teams, so it was really clarifying that roles at the beginning. Yeah, I had some pretty tough meetings with very personal challenges, and being there on my own on a Teams call, yeah, I'm paid to do that, but it was quite difficult to hear some people's experiences some nights sitting with them, so you did have to have a thick skin. We were really clear about the expectations and reality, and we were clear with people how they would help inform, and that has, do you know what, I think if anybody's developing this, it really has made people feel part of it. Skill set, we were developing it as we went along. This isn't a standard way to develop a strategy. It tells you to start with the money and the numbers and then work on your strategy if you look at, but I wanted to do this really differently because of the past. And that just, I mean, covering that feedback to those who have engaged, they can see for themselves now what we've produced from it. And we've really got that kind of pure engagement methodology running through, as Ellie said, all our programme boards, and how we work as an organisation for each plan. We're now developing. Ellie's doing bits of work on mental health and learning disabilities. We're doing lots of work on maternity, but always starting from what matters to you for the future. So it's been a really interesting learning experience, and I'm really proud of the team and what they've helped support me with. We haven't now signed off the board, and all our business goes through what people told us. So it really is for them and with them moving forward into 2027. Thank you.
Thank you, Lorraine and Ellie. That was great. And we're going to move to our final presenters, and I'll pass to Rod, please.
Hi, thank you, Derek. So just to introduce myself, I'm Rod Edgar. I'm Communication and Engagement Manager for Dumfries and Galloway. Health and Social Care Partnership. I'm joined by my colleague Alec. Alec, I don't know if you want to introduce yourself.
Hello, Alec Campbell. I'm the communications team lead.
So hopefully you can see the slideshow. Please let me know if you can't. So to introduce what we're here to talk about today, and that was time to talk. And I think it perhaps is best to give the origins for this piece of work, and that dates back to the start of last year, when our integration joint board had an approach. It was a proposal to undertake a piece of engagement around a very specific aspect of community health and social care. But it was felt by the IGB, in particular the chair, and I have to say I supported this view, that what's perhaps most appropriate to begin with was to start having a general conversation broadly about the entirety of community health and social care. Obviously, COVID had limited engagement opportunities, and rather than us coming out to propose that we knew what maybe was the most important thing to have an initial conversation about, it was to actually gauge people's own thoughts, the service users, ask them first of all to help shape what we would go out with to talk about in specific terms. So we
Rod,
so
just to say, your slides popped up but disappeared.
Oh, I don't know why that should be. I can see here. Can you still see this? Bear with me a second. Let me try it again. Hopefully you can see that.
Yep, there we go.
Let me try it. Please just let me know if it disappears again.
Okay, looks fine.
Okay, so we were charged through the communication team to undertake this piece of work, and what we recognised was that we weren't going out with anything particularly provocative or controversial, which might generate a great deal of interest and engagement. We were basically going out there to talk, to invite conversation around community health and social care. So it was a case, how do we undertake that, and how do we define this to people? So we, as part of the work, we created a fact sheet which sought to define what is meant by community health and social care, and of course, hopefully everybody here will be aware that's cottage hospitals, care homes, GP practices, social work, mental health services. It's a very wide range. But we recognised that perhaps it was going to be challenging to attract people to come to meetings, that we might hold, to come to us to talk about this. So what we saw as the approach principally was to go where people were, was to actually go out into the communities, into the heart of the communities, very much on the ground, hitting the street, literally hitting the street, to undertake this engagement work. So we developed a programme where we proposed to go out across the entirety of our region and position ourselves where we could actually catch people and solicit views from them directly. So, I mean, this was in the likes of pitching up in high streets, in supermarkets, at agricultural shows, at community centres, really every opportunity, anywhere where there was going to be people, that we could tap into. That's where we sought to gain access to them. So we set out, we promoted it. We obviously also provided other means for people to engage outside of that, through an online survey, a physical survey that people could take away and complete and return to us. But by and large, a very big part of this work that we undertook was that in-person engagement. So we recognised that we needed to have a framework for the questions we were asking. Really, nothing was off the table and what we wanted to hear back from people. I mean, it was really just what people's thoughts were on what was working, what was not working within community health and social care, what their concerns were for the future. But we realised we had to have questions which provided a framework so we could do thematic analysis of the results from that, and also that served as prompts for people, because obviously we're catching them fairly cold in a lot of these circumstances and asking them to give thought to, what were the issues that they were experiencing. So these were the very simple questions that we developed, and you might see from that they are, fairly open-ended and general, but they did allow us to have that kind of structure. So in total, 31 in-person engagement sessions took place right across the region, in order to try and catch as many people as possible. And these were advertised, so it was a case of, we will be here at this location, please come along, but also just taking advantage of anybody who was passing and who we could engage with. And similarly to what Highlands had discussed, we also were promoting our presence on social media and showing smiling faces, welcoming people, wanting to talk. I would say, our approach very often in initiating conversation was to say, we're not collecting money, we're collecting opinions, and people were generally, I have to say, very receptive and very willing to engage. And this is an illustration here of some of the events that we attended. What I would say is we were supported in this undertaking by the likes of our public health teams and by our CAMS team, for example. And this was a lot of work to undertake for what is a very small communications team to do this. But what I would point to as well, which I thought was particularly heartening and was a real positive from this outside of the results of the engagement, was the fact that we actually had a lot of buy-in from very senior managers within the Health and Social Care Partnership. On this screen, you will see the Deputy Chief Officer for Health and Social Care, the Director of Pharmacy, the Interim General Manager for Community Health and Social Care. And I think that was really useful in terms of our general approaches to engagement going forward, and that it helped to demystify approaches to engagement. They actually were hearing directly from people. I mean, I think there's a bit of trepidation, perhaps from some aspects of organisations about what will actually be said, what will be heard. And I think to actually have senior figures going out there to actually see this as simple conversations, and it's individuals' experiences and views, and hearing that, I think that was very useful from that perspective. So the outcome was a total of 534 responses collected, and 360, so a significant majority, were through the in-person engagements. What we were particularly heartened by as well was the conversion rate of those respondents who were willing to provide further views to serve in a further fashion as part of our engagement work, because the view was this is obviously a starting point for discussions around community health and social care, but it would lead into more informed, specific pieces of work focused in particular areas. One other thing that I think is important to note as well is the response from the people we engaged with. How often we were thanked for the fact that we were actually reaching out into the community to do this. We didn't have a particular agenda other than to hear from people and to get their thoughts to help build our work going forward. But they were very grateful. They thought that was really great. This was being undertaken, and we often encountered people from out with our area who are saying, well, that'd be great if they did it where we are, and this is great that you're taking this approach. So I think that was very, very positive. So this shows that we had responses from every postcode prefix within our region, with at least one response for every 500 residents in each of the 4 localities. Obviously we have the results from that. I mean, there were things that perhaps we might see commonly across the whole of Scotland, issues around perhaps access to GP services. That was a common issue, and there were quite complex themes which emerged, complex issues to resolve. But at the same time, we also came back with a number of perhaps quick wins, easy wins, things that could be done in an easy, fast manner to resolve issues. For example, we were aware of a couple who lived in a care home, but were not completely dependent on staff there. They were actually independent and going out, and they related that they had healthcare visitors coming to visit them, but hadn't thought to check that they would actually be at home when they went there, and obviously that meant a loss of time for the visitors and also for the people being served. So simply addressing that simply phoning ahead, that sort of was an example of some of the things that could be done to resolve particular specific issues. So we're very heartened by this, and we're building on this work going forward. We've got other pieces of engagement which we're undertaking just now, and we have learned quite a bit from this, and particularly the merits of going out there and speaking to people who might not be expected to talk to you about some of these issues, because a lot of the engagement by appointment, it can be people coming with quite set views, particularly strong views one way or another on a matter, whereas this, I think the feeling was very representative of the region. It was because we were actually going out there and getting people in the street, and I think that's a definite bonus to this type of approach, that you are getting a very kind of representative sampling of what people are experiencing and what they're feeling. So that would conclude our presentation, and we're very happy to take questions on that.
Rod, thank you very much, and Alec, thanks for coming along as well today. Richard, do you want to pick up any questions from the chat box? And for those that we don't get to, we will sweep through the chat box and provide some written answers.
Yeah, thanks, Derek. I think there's been a lot of wide-ranging discussion and comments in the chat, and I would encourage everybody, if you've got a chance, to read back through it after the call's finished, if you still have access to it. A couple of general points, I suppose, is about what makes, if picking up on Amy's question earlier on at the start about what sort of numbers does large-scale engagement consist of, and I think the presentations have showed us that actually sometimes it's not about the numbers, it's about understanding who's potentially affected by a change and making sure that you've got good representation. I don't know whether any of the speakers want to come out with a particular proportion or a particular number that they had in mind, or was there something that there was a kind of success criteria around that? Karina, did you want to come in?
Yeah, I was going to just say that it was something that we kind of ummed and ahed about a lot in terms of what would be kind of good response. So our kind of population that we were looking at was about 23,000, but if we kind of take out under 16s, that left us with about 19,000. So I think we got about a 5% response rate, which, speaking to different people, some people say anything above 3.5% when you're looking at general population is good, but we would have always wanted more. But I think a lot of it depends on what you're asking and how specifically you're asking. If you've got a very niche question, then you'll appeal to a niche kind of population, whereas if it's generalised, a lot of people think it doesn't apply to them. So it's it can go both ways.
Lorraine, do you want to come in?
Yeah, I try not to put a number on it. I think it was more about reaching people and making sure that we had the spread across and that people knew how and when they could contact. So it was more about making sure that we had, the tentacles across the whole of Highland, rather than how many we got back. Because if people did feel passionate about it, we certainly got that in bucket loads. So that was more my measure of success, how many people we'd reached, not how many people actually got back to us. That's maybe controversial.
Alexander, do you want to come in?
Yeah, just to say, this is a question that came out of our recent participation and engagement strategy work. What is a definition of good engagement, of enough engagement? And we're working on that at the moment, but I'd be really interested in hearing from other people, maybe outside this call, about what definitions they've developed, what they think of as good enough, whether it's numbers or geographical reach or whatever other criteria.
Yeah, and Lois?
Yeah, I think kind of going back to my questions at the start, I personally felt like anyone who took the time in their personal time to sit down and read our 3-year strategic plan, I was delighted to hear from, and they were better people than me, because I spend a Friday night with a glass of wine and Gogglebox and not reading through strategic plans. So like just getting any feedback, and then I think I would reflect what other people have said. It was about the quality of it. It's about what people were telling us. Were they talking about things that also we could make use of, because we get quite a lot about the bins and we don't deal with the bins. So it's also like, is it feedback that's relevant, and that is something that we can use as well. So I think we definitely focus more on that than the numbers. Not that the numbers aren't important.
Great. Richard, just conscious of time, and I know we have a commitment to sweep through the box and send the presenters any specific questions. We are going to post the recording and the slides on our web page that hosts our webinar information, but we'll leave you with some closing questions and an opportunity just to repopulate that word cloud about how you feel now about large scale engagement. Thank you very much for joining. We had over 100 points during the session, which is fantastic. 4 great sessions. Thanks to Karina, to Lois, Lorraine, Ellie, to Rod and to Alec for coming along and giving some of their time for today. It's much appreciated. Thanks to everyone for attending and for all the questions and comments in the box. And we'll hopefully see you at a future webinar. Thanks very much, everyone.